I'd like to ask you about supplements for a moment. I've heard you talk about two in particular, one that I'm very familiar with, which is creatine monohydrate. If you could,
so touching on creatine, it is the most tested, safe, and effective sports supplement we have. I mean, there are thousands of studies on creatine monohydrate now. And I would say very clearly too, if you're using any other form of creatine, I think you're wasting your money. Creatine hydrochloride has some hype around it. It's apparently it's a little more soluble. The claim is that you need less, but there's only a couple studies on it, and it's more expensive. So I tell people, just take creatine monohydrate. It is tried and true. It's been shown to saturate the muscle cells 100% with phosphocreatine, and that's what you want. So creatine works through a few different methodologies. One, through increasing phosphocreatine content, which helps improve exercise performance. It also appears to improve recovery, and it increases lean mass, a lot of which is through bringing water into the muscle cells. But muscle cells are mostly water. So when people say, well, it's just water, that's what muscle cells mostly are. And it also increases strength and some other metrics. Now, it also has been shown in studies that people tend to get a decrease in body fat percentage. Now, that's probably because they're getting an increase in lean mass, and so the relative is a decrease in body fat percentage. But there are a few studies that show a decrease in fat mass as well. I don't think that creatine's a fat burner. I think that people are able to train harder, build more lean tissue, and so that's probably having an effect on fat mass.
Do you emphasize the classic loading of creatine, taking it a bunch of times per day and then backing off, or just taking it consistently at I think 5 grams per day is kind of the typical dose that people take?
So again, no solutions, only trade-offs. You can load it and you will saturate your phosphocreatine stores faster, like usually within a week. If you just take 5 grams per day, it'll take 2, 3, 4 weeks, but you will get to the same place. And you're probably going to have a much lower risk of GI issues. Some people, creatine can be a gut irritant. If it is for some folks, I would recommend splitting it into multiple doses. So maybe like multiple 1 or 2 gram doses per day.